Hi, my name is Keefe. I'm a family medicine resident at St. Francis Medical Center and a PMAD survivor.
Hi, my name is Walter Chun. I'm a general pediatrician here in the Richmond area, and our practice is very interested in postpartum depression and PMAD screening.
My name is Alethia Watford. I'm the clinical social worker at the VCU Health System for general pediatrics, where we screen moms for perinatal mood and anxiety disorders.
Hi, I'm Janet Abraham. I'm the clinical social worker in the Department of OB/GYN at VCU Medical Center.
Hi, my name is Adrienne Griffen. I'm the founder and executive director of Postpartum Support Virginia, where our mission is to help new moms overcome postpartum depression. Please join us in conversation. Postpartum depression, which is the most common complication of pregnancy and childbirth, affects 1 in 5 moms. But we know so much more about it now. We know it's not just postpartum, meaning after the baby is born, but also during pregnancy. And we know it's not just depression, but it's also a lot of anxiety. So we have this big fancy term, perinatal, meaning the time frame from conception to baby's first birthday, mood and anxiety disorders. So you'll hear us refer to PMADs or PPD, but what we're really talking about is mental health issues that affect women during this important time frame, during pregnancy and the first year postpartum.
Well, a lot of times as we have the opportunity to really get to know these women over a 9-month period, we're able to monitor their behavior, monitor their mood, and we try to do what we can at the Department of OB/GYN to normalize their prenatal care and start from the very first OB appointment with a prenatal screening. It's an Edinburgh screening tool that assists us in helping them tune in to how their moods are. So we do that, and we do that also another time, which is your 3rd trimester.
You know, that is so fabulous. That is exactly what every obstetric provider should be doing. We know these are so common, these issues,
really are.
that we really need to get a baseline at sort of that, for that first trimester.
Right.
And then again at the 3rd trimester.
Sure.
And then at the postpartum time.
Exactly,
right?
exactly.
So, Kara, why don't you tell us a little bit about what your experience was, and were you screened when you were a new mom?
Yeah, sure. So I had my daughter after my 3rd year of medical school, and I was screened both when I was pregnant with her and then also at my 6-week postpartum follow-up. And I remember thinking, all right, I don't have postpartum depression. I kind of like passed the screening. But for me, I kind of started having more heightened anxiety that led to a lot of issues with not sleeping and that sort of thing, closer to when my daughter was about 2 months old, so just a few weeks after that. And now that I have this little guy and had a very healthy pregnancy and have had a postpartum period where I haven't been dealing with the depression and anxiety, I can look back on my first pregnancy and just recognize that I had anxiety that was a lot more heightened than it is for a normal first-time mom. Because I think something that in talking to women and from my own experience I've learned is that, you know, first-time moms, like, we do have a little anxiety, we do have a little bit of this, and so people can say, oh yeah, of course you're not sleeping, of course you have, you know, you're worried about X, Y, and Z, which I think is why it's so important to use a screening tool that actually is specifically designed to catch these issues, because it goes a little bit deeper than those little conversations that we have.
Right. Walter, can you talk a little bit about the screening tool that a couple of people have referenced?
We also use, as does Janet at VCU, in my practice, the Edinburgh postnatal depression screening test. It's very easy to implement in the office. It takes about 5 minutes to complete, and it's 10 questions. It sort of rules out some of the things that may be confused initially for, you know, fatigue and things like that. It really kind of focuses, I think, mostly on some of the mood and anxiety issues, feelings of happiness and such. I think it does a really good job, and then that, of course, is just an objective score, and it's a lead point for discussion, but you know, there are cutoffs at which, you know, it triggers certain actions by us as far as referral to resources or other providers.
Right. What I really like what you said is that yes, it's a screening tool, but it's meant to engage the mom in conversation about what's going on. It's not just like here, fill out this form. Right. It's like, hey, I see you answered this. What's going on? Let's talk about this a little bit.
Right.
Or even if things are going great, thank you for completing our form. It appears that things are going well.
Right.
And
Kind of affirms and just reclarifies for them that they're on a good path, but it's important to us. Yeah.
So many practitioners use the EPDS, as we call it. There's other screening tools, but what's really good about the EPDS is that it's short, as you said, it's free. It's been validated in both the postpartum period and during pregnancy. It's good for both moms and dads, and it teases out both that anxiety and depression components. So it really is the go-to screening tool. Yeah.
You know, another good thing, just to piggyback on what Walter said, is that the screening tool has also been made available on Android and Apple phones for e-screening. So a physician could clearly connect with a patient that may not be in an office that does do a triage call and you're concerned about them. You can have them fill that out after you do obviously the releases of information and transmit that information and expeditiously get your patient connected to the dots.
Great, especially as we're moving more and more to
Absolutely.
medical records.
It's just I wanted to throw that in because it makes it very available to folks.
In addition to that, it also has been translated into other languages.
Right.
Yeah, good point.
Yes. Thank you. So Alethia, tell us a little bit about how you and Janet work together at VCU.
So at VCU, Janet works in the OB clinic and I work in the pediatrician's office. So we see the babies pretty regularly right after the baby's born. So generally the next day or at least 2 days later, and we give mom the screening to kind of assess their mood. So it can be kind of tricky in that the baby just came home from the hospital, so it could just be that baby blues period. But the good thing about what we do is we rescreen them again in 2 weeks, and then we screen them again in 2 months, and then 4 months and 6 months as well. And sometimes, depending on how moms present when they come to the office, we'll give it to them if the baby is 8 months or a year old.
Right, that's great. That's awesome. You know, when I first started doing this work and people said they would screen, either in the hospital or at those first early visits, I was like, why? It's postpartum. It doesn't kick in for a while. But we know that, women start having that heightened anxiety during pregnancy. And we know that half the cases of postpartum issues actually start in that third trimester. So it's really, really important that we're talking about this from the moment the mom is pregnant all the way through pregnancy. And then again, throughout that first year postpartum. So, really great news. Last week, the American College of Obstetricians and Gynecologists, which is the governing board for all OBGYNs, came out with a new recommendation, a new opinion, that is encouraging obstetric providers to see those new moms earlier than the 6-week visit. Like they're talking 2 or 3 weeks. And the number one thing that they want to assess for is mental health. Right. So this is great. I mean, this is a watershed. This is really huge.
And I was going to add, when she mentioned at her 6-week visit, she was okay. But then 2 weeks after that, she started having those symptoms. Well, her 6-week visit has come and gone, so she's not going to really see her OB provider anymore after that.
And that's why it's so important that the pediatricians are doing this, right? Because how many times do you see a mom or, a new baby over the course of that first year?
And sometimes the visit is dominated by certain aspects that the parents want to bring up, in regards to development and such. But I think having the screening tool again in place that's part of your routine makes it a piece that has to be discussed, can't be skirted over. But to your point, I think longitudinally it's extremely important as the months go on. We even do an additional screening at 12 months based on the information through the DC Collaborative.
Right.
Similar in the beginning, but a little longer out. But sometimes it's an evolution, so I think it is important. And once a positive screening is flagged in the chart, it's always going to be a conversation piece to pay.
So one of the things that we're also doing at Postpartum Virginia is we're passing out information cards to OBs and pediatricians and the hospitals. We want to get these cards in the hands of moms routinely during this 2-year time frame. So it lists all the important information about signs and symptoms, but most importantly is where to go for help. when I was struggling after my son was born, I knew all of this. I'm like, yes, 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 yes. And it would be talk to your healthcare provider. And I did, and it was a disaster. So we try to give the very most local information. So if we have, say, a hospital that has a support group, we list that information, and then that's what they hand out. And then we give this to the OBs and pediatricians. So we encourage the OBs to at least give it at the first trimester and the third trimester. And then the pediatricians, it's like just put it as part of the packet that you give parents for all the well baby checks, right? Because they get information about, put baby to sleep on your back, and here's what they should be eating. So just tuck this in there as well. Yeah. And so while the screening is good, we're also giving them the information in a more passive way.
It's just as important,
right?
Because I think you can recognize it, but in the past before, we have a resource, Janet has a wonderful resource.
Right, can you show
this
us
discussion is fantastic because I just found out about this resource, and we practice medicine in the same locale.
And this was really a unique opportunity where we partnered with VCU Health, and they were able to provide us with the resource, the physical resource, but we put together basically a mother's guide for postpartum depression, and we provide them with this prior to having a baby, so they can read about the trajectory of what's going on and what they can expect, and then obviously also what to do if you're in need of help. So I think that it's been a good toolkit for folks, and it's really it's demystified what to do if you don't feel good.
Right.
And, and you use it a lot too.
So even if moms don't get it before the
Right.
baby's born or right after the baby's delivered, once they come to see us,
You give it again.
give them that.
I mean, I think having the resource, but I find that just the persistence through someone like Alethia, or the pediatrician, from my perspective, each time, because a lot of times when you're in a bad mood, it's difficult to pick up that phone. So I think navigating the system for all mental health issues, not just postpartum depression, in my case, children with mental health issues, it's increasingly difficult. The resources are limited, and so I think anything that we can do, a list that has an up-to-date number of people in your area that are seeing patients, and not 10 months from now,
right.
I think can help.
So the way our system works now, in general, I mean, except for here where people are actually talking about it, is that, we don't talk about this, the most common complication of pregnancy and childbirth. We let women go along till they get worse and worse, and they fall off the cliff into the abyss of anxiety or depression. And then we expect them to say, hey, number one, I recognize that something's wrong. Number two, I need help. And number three, then they have to figure it out when they're at their most vulnerable.
Right.
So we really need to change the whole thing, got to dial it back and be saying from the moment a mom is pregnant, hey, Janet, we're going to talk about a bunch of things. We're going to screen you for a bunch of things during your pregnancy, one of which is your mental health. We know it's as important as your physical health. Both have a direct impact on their baby and on you. And really demystify it. I mean, I think for so long people have been like, well, I don't want to talk about it because I don't know what to do. I'm embarrassed. We got to reduce that stigma. It is the most common complication. And it affects women at all stages and all ages, all ends of the socioeconomic spectrum, because we know it's caused by a whole bunch of different things. We know that there's this huge change in hormones during pregnancy and right after a woman delivers. We know that it can be compounded by the lack of sleep, by the inherent characteristics that a woman has, previous history, trauma. I mean, there's a lot of stuff that goes into causing this. What we want to make sure is that women understand if they're experiencing this, that this is not their fault in any way. I know that in some communities, people, if they talk about it, it's like, well, you're sort of shamed, like you made this happen, or, you did something wrong. And no, it's not. This is something that happens to a woman, and sometimes to a dad too, right? We know 1 in 10 dads can experience postpartum depression. Do you see any dads in your practice who may experience this, or they're probably even less likely to talk about it? Yeah, angry.
We see the dads a little less often. That's just how it goes. But we certainly have, but nowhere near from what we're finding with the mom.
I can't remember if it was you or another pediatrician I was talking to who said that they make both parents come in for the 4-month visit. Was it you?
It wasn't me,
No,
but I like that idea.
Yeah.
It is awesome.
Because then you can sort of screen both of them and say, hey, mom, how are you doing? Hey, other
Or not
partner.
just to screen
But
the
to
dad
have
also, but
to have that conversation.
to let the dad know that these are the things to look for in the mom, because no one knows that individual more than the other adult.
Right, and I think this, because we know there's so many well baby checks, like 2 weeks, a month, 2 months, 4 months, and I think they picked 4 months because the peak incidence for postpartum depression is actually between 2 and 4 months, right?
Yeah. You know, another thing, Walter, that we do in our office space that you might find of interest is we have the, I think it's the Postpartum Support International 1 in 7 women are going to experience it. So a woman walks in, she sees this image of a woman who is suffering from postpartum depression, and then we also have the companion piece in Spanish, you know, so they know that it's a safe space to talk.
Right.
And they have that kind of relationship with you all too, because you get to know them really well.
Yeah.
So it's really kind of, and we've had patients that comment on that, like, oh, what's that? Or, it's a conversation starter sometimes also.
Right, because again, it's all about the conversation, right? Nobody just wants to be handed a piece of paper.
No.
It's like,
Not going to even read it.
exactly. It's like, hey, Mom, I care about you. It's, yeah. So, you know, a couple other things. So what does it take to get a woman feeling well again, right? So at Postpartum Support Virginia, we've come up with something that we call the path to wellness. And we know it's a series of different things. We started to refer to this as sort of like the scaffolding that somebody needs to feel well. And it starts very basic with self-care, the very basics of getting enough sleep and eating properly and getting a little bit of exercise and getting some time off. Things that naturally keep us going, but when a mom has a new baby, it's almost impossible. So we help moms figure that out. Like, how can I get 4 or 5 hours of uninterrupted sleep? How can I get a little exercise? And I'm not talking about like running the Boston Marathon, but you know, get outside, get some fresh air, take a walk around the block, all of those things. And in fact, we came up with these little door hangers, which we try to get out, that actually talk about daily requirements for new mothers. 4 to 5 hours of uninterrupted sleep, nutritious high protein meals, light exercise and sunshine, and 15 minutes of me time. And so, you know, they put this on the door, shh, Mom is resting. I know, so we also, when we get more money, we'll print more of these. But the idea being that mom really needs to take care of herself.
Can I use that with my adult children also?
Oh, yes, yeah.
That's awesome.
And we know that in some cultures, like we were talking earlier about, you have several friends who are from India. And tell us about what happens when they have a baby.
I think so often they have family that comes, you know, and stays with them. And part of that is having the support of somebody in the house, but a lot of it is also just that knowledge that you have from like your own mother, you know, who raised you obviously to a point where you're healthy and well, and you can have somebody right there to talk about, you know, what you're going through, or, you know, is the baby supposed to be doing this? Is this normal? You know, what, like kind of the expectations. Because I know with me, and I think with a lot of women, one of the reasons we can kind of have issues postpartum is because there are so many expectations that are set on new mothers that we see from images either on television or things that we read. There's, you know, a lot of things that you're supposed to do with baby as far as feeding and sleeping and these different components, and you feel like if your baby isn't, you know, breastfeeding well, or if your baby wakes up every hour, you know, and you're not doing a good job and it's your fault, whereas I think mothers, you know, people who've gone through this really know that there's so much variability with
and
babies.
There's 2 people involved in this relationship. It's mother and baby, right? And,
Exactly.
You know, everybody thinks that, right, as you said, if something's not going right, well, then mom's doing something wrong. Well, hang on, it's a relationship with
And you can feel like I'm doing this wrong, I'm doing that wrong, and it can really just, you know, get on top of you.
Right. So we talked about sort of the self-care. That's the very first thing that we encourage moms to do. Second, of course, is some social support. So at Postpartum Support Virginia, one of our goals is we provide free support groups. Our goal is to have a group at every hospital in Virginia that delivers babies, because we know moms are sometimes lacking that social support. Maybe they've been at work up until the day the baby is born. You know, I often talk with my mom about this, and she said when she was having us, everything was very different. You know, the expectations were different. You know, a woman was either a nurse or a teacher, and then she got married and stayed home and had kids. And everybody was doing that. So everybody on the street, you know, so you had this natural social support system, and your mother lived around the corner and your sister lived down the street. I mean, I'm glorifying things, but things were very different. You know, it's really not like that.
A lot more single-parent households.
Single-parent households. Mom has to go back to work. Nobody in the neighborhood is staying at home. I mean, lots of things. So we have these support groups so that women can come, sit like this, talk among themselves, cheer each other on, and we find that, you know, as people progress and get better, then they pull the next mom along with them.
And that for me was the first thing, like the first resource really that I found was there was one support group in Richmond at the time I had my daughter, and it was my lifeline. I looked forward to that every month, being able to go to that. And I know one thing that was great is having those other women there, and they could see the difference in me, even if I couldn't see the difference in me.
I know sometimes the moms come back and they're like, wow, you look so, what did you do? And they can say, well, I started getting more sleep, or I started having therapy. That was the next thing. We find a lot of women really benefit from very short-term, pragmatic, focused therapy that is focused on symptom relief and managing your emotions so that you can engage with baby and really, be a good mom. And then the fourth piece of the puzzle is medication.
Right.
And fortunately, there are safe and effective medications that women can take either during pregnancy or while they're breastfeeding. So we find that the package deal of improved self-care, social support, therapy, and medication helps all women get well again. And this is really, really important. These are temporary illnesses.
Very temporary.
Right? It is not a life sentence. And that's also what we try to encourage.
And it can feel like that when you're going through it. You feel like it's never going to get better. But all the resources we've talked about, and I know that this time, both being pregnant and definitely going to my pediatrician this time around has been a complete 180, because I see all these resources when I go into the office. And of course, going through the postpartum depression and anxiety the first time, I kind of had a plan in place this time around, but if all these things I think had been there the first time, I don't think I would have gotten to as low of a place that I was in. And just like you spoke earlier, it really helps to normalize everything. And these resources also have given a lot of confidence, I think, to providers, as well to our medical providers, because people, whether it's nurses, social workers, physicians, would see moms that had issues, but if you don't know where to send a mom, what are you going to do? And really the work that we've been doing in Richmond over the past year or so has helped to develop more support groups and identify more people that are comfortable talking to moms about these issues, and of course becoming their providers as well.
I like what you said about if you had the resources before, and just like now we talk about having a birth plan, it's almost like we need to have a plan earlier on of how we're going to deal with this. Just being more proactive. You may not have these experiences, but if you do, here's a plan that we've already talked about, so you're not scrambling.
And that's on the Postpartum Support Virginia website.
I started using this analogy that the pregnancy and the birth is kind of like when you're engaged to be married, and like all the focus is on the events of either the wedding or the baby being born. You can't even begin to imagine what it's going to be like to be married or to have a baby. So we did come up with this plan called the Realistic Postpartum Plan, and it helps mom and dad or whoever the parents to think about, okay, what are we going to do about food, about sleep, about childcare if there's other children, about maybe going back to work, whatever. All of those thoughts that you don't even realize you need to talk about because you're just focused on that birth plan, right?
And it's interesting because I've used that plan with several patients, particularly patients that had previous historic issues with anxiety. The outcomes are incredible.
It's amazing.
They're incredible. And it's so reassuring to see that.
So
it's just
postpartum
a
depression is actually preventable.
Exactly.
Yeah, so I have postpartum issues with my second, and we decided to have a third, and we put a lot of things in place.
It's pretty amazing.
And we kind of circumvented, and like for me,
and you can just see them, just see the anxiety level, just getting.
Yeah, I haven't been, embarrassed to say, I've been on the website to see that. Is it a easily navigable tool that you?
Yeah, so
you basically fill in the elements of what you want it to be a part of your plan.
Right.
And it takes the anxiety from here, puts it on a piece of paper, some ownership, and everybody in the family has had an opportunity to dialogue about this.
Right.
And it's amazing.
So for example, there's a page on what are we going to do about food.
Yeah, and
so
you
it's
write it out.
Okay, so we can here's places we'd like to order out from, or I'm going to make X number of meals and put them in the freezer.
And put them in the freezer.
Or we're going to sign up for a food chain.
Yeah, it's awesome.
Or food train or whatever those things are. And so very, very practical. Now we don't want people to obsess and say I got to fill in every line, but the idea is to get
it's
that
a guide.
conversation.
It's just a roadmap.
Right.
Yeah, but it's pretty cool.
Yeah.
It really is.
So we've started doing that.
When it comes to baby blues, I talk to moms about when they first come home, how'd it go, first night home. From a sleep standpoint, relatively speaking, you do have a newborn baby. And then from an eating standpoint, are you having any crying spells? If you do, are you able to kind of have your moment and then function enough to take care of the baby and take care of yourself as well? And so generally that's about a 2-week time frame. And so after 2 weeks, if mom scores continue to be high, there's no change as far as how their mood is feeling, I guess shifting more towards getting more back to themselves, then that becomes a little bit more concerning about maybe
Tell
there
them
might
what you
be
do when
something
something
else going
happens,
on.
when it's bad.
So if mom's scores are high and they're having in the presence of thoughts of self-harm, because that is a part of the screening tool. So it really becomes a matter of assessing to determine the acuity of that. If so, because the form really looks at the last 7 days, sometimes moms don't really pay attention to that because they're really overwhelmed. They're just coming in trying to get their baby looked at. But if it was in the past 7 days, or if it was today, if they tell me right now I'm having thoughts about wanting to hurt myself, then there's a process that we can do to kind of get them further assessed. If it's not so acute, then I reach out to Janet to get moms into the peripartum clinic where they can have access to a psychiatrist if that's necessary, as well as connecting them with a therapist. And also in clinic, I will pull up the Postpartum Support Virginia website and get some information, whether it's about support groups or therapists to provide.
Yeah, so what you all have going on at VCU is really quite amazing. You know, you're working in the obstetric setting to screen the moms and connect them with resources. In the pediatric setting, you're working together. Like, that's a model that needs to be replicated in more places.
It's a great model. I mean, it sounds like, so Alethia, you see every baby that comes in, or?
Well, no, I don't see every baby, but if
Super
moms
Alethia.
score high on the Edinburgh, then I do have to see them.
Okay.
She has a hotline to me, and I have a hotline to her.
Well, so it would be nice in a perfect world, you know, for those of us out in the community in the trenches, to have kind of that access to. And I think that's the access piece is.
And you do that. You do that. This art, what she spoke about, and thank you for bringing that
Yeah,
up.
I need to get
the
that
peripartum clinic is available not only to VCU moms,
For sure.
but to women in the community.
So this
as
is
well.
why this is good, because I mean, just like we're talking, I did not know that. And,
There's
we
so
can
many
see-
resources. Part of what Postpartum Support Virginia is doing as we get people on the ground at different locations is going out to the OBs and the pediatricians, letting them
Outreach,
know,
yeah.
right, you know, not only here's how to talk about it, but here's the resources. We have various support groups connecting specific practices with mental health providers so that you have a connection and can say, hey, let me call my friend over here and let me get
I mean,
you in.
it sounds so simple that I need that number, but what I had a recent experience, a baby who had delivered downtown at your facility, and the score was significant, and it wasn't self-harm, but I was concerned, and I called her OBs, the residents, the office, and I had, I think there was some unfamiliarity. Because I think I spoke with an ancillary staff, but I think I needed that number. And she got taken care of, and she's doing great. But I mean, it's little things like that that sometimes logistics. I think,
Right, we want to make it as
huge.
easy as possible for moms to get help and make those warm handoffs whenever we can. First, we talked a little bit about the baby blues. I want to make sure everybody knows that that's really sort of the normal transition, right? That moms are kind of up and down, you know, the hormonal changes, the lack of sleep, that new baby in the house, all of that. But those should level out about 2 or 3 weeks. If they don't, or if it gets worse, that's when we get concerned, right? So that's the important thing about that. You know, one thing that we haven't talked about is the idea that lots of women during this time frame have these scary thoughts of harm coming to themselves or to their baby, and often at their own hands. And this is very, very common and very not talked about because it can be kind of scary. You know, what mom is going to say, hey, I have this beautiful new baby and, you know, I have visions of, you know, tossing the baby down the stairs or out the window or whatever. It's very, very common, and it's a symptom of OCD, obsessive compulsive disorder. And we need to actually normalize this more than virtually anything else. We need to say to moms, and I always do whenever I talk to them, how's it going? Are you, I do all my questions, but also, are you having thoughts that are scaring you? Thoughts of hurting yourself or your baby? And it gives them an opportunity. It makes me say it first so they don't have to. And it gives them the opportunity to say, yeah. And I say, I had these thoughts. I remember standing at the top of the stairs holding my baby thinking, what if I just fell down the stairs? How long would we lie there? Who would find us? And as soon as I said that, they're like, oh yeah, I had this thought about doing whatever. And I would never do it. And that's really good when they say, I would never do that. That's what we want to hear. If they're having these thoughts and they're resonating with them and they want to act on them, that's when we get really concerned, right?
I like how you framed it as, are you having any scary thoughts? Because one of the questions on the Edinburgh and on most screens for depression and suicidality, say, are you having any thoughts of harming yourself or anyone else? And those are kind of thoughts of harming someone else, the baby, but it's different. And I think that you can recognize that even when you're in that place. And so to have somebody frame it in a different way, that kind of signals to them that you understand what they are actually experiencing.